Hello viewers, my name is Adushoke Eguonor Loveth. I'm an intern pharmacist at the University Teaching Hospital Ilorin. I'm here to talk about the World Parkinson Day, also known as the World Parkinson Awareness Day. The theme for this year is the mental health in Parkinson and Parkinson care. Have you heard of the word Parkinson disease? Are you diagnosed with Parkinson disease? Or do you have a family member or friend diagnosed with Parkinson disease? Join us as we discuss Parkinson disease, its symptoms, diagnosis, treatment, and risk factors associated with Parkinson disease. Parkinson disease is celebrated on the 11th of April every year to commemorate a surgeon, apothecary, geologist, and political activist, James Parkinson. James Parkinson is the first person to medically describe Parkinson disease in the year 1817. In 2016, 6 million Parkinson disease cases were reported, and in 2020, an estimated value of 9.4 million Parkinson disease cases were also reported. The rise in the Parkinson disease prevalence estimate calls attention to the increasing individual and the society body and the pressing need for measures to address and impact this challenging disease. What is Parkinson disease? Parkinson disease is a neurodegenerative disorder which affects predominantly dopamine producing neurons in a specific area of the brain called the substantia nigra, thereby resulting in low dopamine level in the brain. Dopamine plays a role in sending message to the specific part of the brain that is responsible for movement and coordination. There are various symptoms associated with Parkinson disease. The symptoms of Parkinson disease often begin gradually and progresses over time, which include the motor and non-motor symptoms. The motor symptoms include bradykinesia, rigidity or stiffness, tremor at rest. Then we also have the non-motor symptoms, which include constipation, changes in memory and cognition, orthostatic hypotension, anxiety and depression, problem sleeping, and problem urinating. We also have risk factors associated to Parkinson disease. Age is the biggest risk factor for developing Parkinson disease, and the average onset of age is 60 years. Then also, men are more likely to develop Parkinson disease than women. Individuals with a siblings or family member who is affected with Parkinson disease have approximately 2 times the chances of developing Parkinson disease. The environmental causes like farming chemicals like pesticide and herbicide is also a risk factor for developing Parkinson disease. Head tremor, which is as a result of multiple blows to the head, is also a risk factor for developing Parkinson disease. Diagnosis of Parkinson disease. There is no specific test for diagnosing Parkinson disease. Neurologists often diagnose Parkinson disease based on physical examination, medical history taking, and review of signs and symptoms. Then there are also tests that will help to support the suspicion that an individual has Parkinson disease, which include the blood test, the genetic testing, the dopamine transporter scan, and the magnetic resonance imaging. We have various types of Parkinson disease, which include the idiopathic Parkinson disease. This is the most common type of Parkinson disease, accounting about 85% cases. It is also called Parkinson disease because its cause is unclear and it may occur spontaneously. It's usually developed between the age of 55 to 65 years and barely developed before the age of 50. Then we also have the vascular Parkinsonism. This is as a result of multiple stroke to a specific area of the brain. Then we also have the drug-induced Parkinsonism. This is as a result of side effects of some certain medications, which include the antidepressants, antipsychotic agents, the antiemetic, anti-epileptic agents, and the calcium channel blocker and dopamine depleting agents. We also have therapeutic and non-therapeutic measures for maintaining Parkinson disease. The therapeutic measure involve the use of medication, while the non-therapeutic measure involve the supportive therapy. Pharmacists are uniquely placed to optimize treatment regimen to improve the patient's quality of life and also enhance long-term outcome. Pharmacists Pharmacists are equally vigilant about preventing medication error that could result in adverse drug reaction. Also, healthcare professionals should look into non-motor symptom and coordination. Finally, Parkinson's disease is not a death sentence. It can be well managed, and there are steps individuals can take to help maintain their functioning and health. Thank you.